Okay, in this lecture, we'll talk a little bit about a part of the integumentary system, right? Integumentary is skin, hair, and nails. So let's talk about some of these structures here. You'll notice the top layer here is the epidermis when we move, and the epidermis is made up of 5 microscopic layers that I'll get into in a second. The dermis is made up of 2 layers, the papillary layer and the reticular layer. And then the deepest layer is the subcutaneous or the hypodermis. The top layer is 5 microscopic layers. We're going to talk about that. Notice in the dermis, we have some muscle here. We have the hair. We have some glands. We have a sweat gland. We have an oil gland. We have some nerve endings. And in the deep layer, we have some fat. So let's look at the 5 layers, microscopic layers of the epidermis. Little silly mnemonic to help you remember it. Cher loves getting skin Botox. Cher loves getting skin Botox. So the top layer is like 25 to 30 layers of squamous cells, stratified squamous. So it's called a stratum corneum. Stratum, like stratosphere, just means layer. These are dead cells. All of the cells are actually made here in the stratum germinative layer. This germinative layer and this basal layer, they're made up of stem cells. And these cells produce and they start pushing upward. It takes about 4 weeks for these cells to migrate upward. And as they move up, by the end of the 4 weeks, these are dead cells that slough off. Okay, so you have stem cells here. They start to grow and they push up, 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 and eventually they die off. And then you slough them off, and then like Doritos, don't worry, we'll make more, and it does it all over again. So you have the stratum corneum. The stratum lucidum is a lucid layer. This layer we have in the parts of the body where we need thicker skin, like the palms of the hand and the soles of the feet. If it's not the palms of the hand and the soles of the feet, you're not going to have this lucid layer. It skips it and goes to the granular layer, the stratum granulosum, where it's granular and it produces some fatty cholesterol type of substance. The stratum spinosum, it looks spiny, and then the stratum basal layer or the stratum germinativum. Sometimes these are interchangeable. So Cher loves getting skin Botox because sometimes it's called the stratum basal layer or the stratum germinativum. Almost the same thing. Okay. Down below that, now we're into the dermis. So we have the dermal papilla. These dermal papilla are unique. They help to create the unique fingerprint that each of us have. They're a little bit different from person to person. So if we wanted to name this or drag and drop, this layer from here to here, that's all the epidermis that's made up of these 5 layers. The stratum corneum, the stratum lucidum, the stratum granulosum, stratum spinosum, and then the stratum basal layer, sometimes called the germinativum. Below that is the dermis. Cher loves getting skin Botox. Epidermis, 5 layers above, and the dermis has the reticular layer and the papillary layer down below. So what is this highlighted section up here on top? That would be the epidermis. What is the layer below that? That's highlighted. That would be the dermis. And then what is the layer highlighted deep to that? That's the subcutaneous or the hypodermis. What is that top layer? Right, 25 to 30 layers. That is the stratum corneum. After the stratum corneum, Cher loves, that's this one here. That's the lucidum, stratum lucidum. And then what is this layer all the way down at the bottom? If we don't see the germinativum, look for basal. Cher loves getting skin Botox, so that would be the stratum basal layer. And then what are those hills that are involved in making the fingerprint. That's called the dermal papilla. Let's finish up with the nails. When we look at the nails, we have the free edge. We have the nail body that should be pink. Then the lanula should be white. And then you have your cuticle back here and the nail root. If we look at it from a different view, right, here's the distal phalange of your finger, right? So we're looking at this portion here. From the lateral view, here's the free edge. Here's the nail body, should be pinkish. Here is the lanula, should be a little white, like semi-lunar, like a moon-shaped. Here's the cuticle or the empochium. And then here's the nail root. Now, just adjacent to the nail root is the matrix. And the nail matrix is epithelium that's proximal to the nail root, and it is made up of these dividing cells that regenerate and produce that end up pushing the nail up forward. Okay? So when we look at these structures right here, this is the nail body. And when we look right here, this would be the nail root. Nail body is here. And if it was back here, this would be the nail matrix. Now, the nail is really important because it gives us a lot of information. When I do my physical exam with my patients, the first thing I do is I shake the patient's hand. I feel the grip. That tells me a lot about their muscle tone and their protein intake and the strength. But I turn their hand over and I look at the shape and color of the fingernails, because I have picked up a lot of celiac disease by looking at the knee. I picked up chronic obstructive pulmonary disease, lung problems, and heart problems, especially when you see this clubbing effect. Notice the cuticle is very thick and the nail thickens and clubs downward. These are seen with advanced lung issues. I've seen it in heavy smokers, emphysema, lung cancer, people that smoke a lot, or people that have celiacs also have this club-shaped nail. Looks like this. This is what it looks like. So we'll see it in advanced type of lung disease. We'll see it with inflammatory bowel disease, severe cardiovascular issues. We also see it with AIDS as well. Now, the opposite of clubbing of the nails is what we call spooning. Spooning of the nails is the opposite, right? Clubbing goes down and spooning goes up. We see this with severe fungal infections and severe diabetics. When we see a white nail, remember I said the nail body, we said this portion here should be pink. When it's white, I'm thinking it's a type of anemia. Maybe it's iron deficiency anemia or B12 anemia. This should be pink. The tongue should be pink, and the lower lid of the eye, if you pull it down, it should be pink. If all of them are white, it's typically anemia. We've seen it in congestive heart failure, malnourishment, and severe liver disease. One of my patients, I picked this up not too long ago, where he had this black line. When we talk about skin cancer, it just doesn't show up in the skin. It can actually show up in the nail. This is a melanoma type of cancer. Okay, so looking at nails are really, really important. It tells us a lot. You can pick up when someone's chronically ill. You can pick up when there's protein deficiency. You can pick up thyroid disease. You can pick up psoriasis. You can pick up anemias. There are so many different type of issues and metabolic issues that can be early assessed through simple observation. Here in this case, we have these vertical lines. It kind of looks like wax that's dripping down. So we'll see these, especially with B vitamin deficiencies when the person's under stress. We'll see it with diabetes, thyroid issues. We'll also see it with an endocrine disorder called Addison's disease, which is a problem and imbalance with cortisol. So again, you don't have to be able to diagnose these things, nor am I expecting you to, but simply saying, this does not look normal. You know what a normal nail looks like. Once you see something abnormal, this is where you integrate and associate with other healthcare professionals that may know. If you don't know, at least you can associate with other people that are resourceful enough that do know, and then you become the hero simply by making the referral.